Hi, everyone. We'll go ahead and get started. Um, First, welcome to our Optimizing Patient Care Through Community Health Needs Assessments webinar. Today, we're joined by Cara Gambill, a senior partner at Burrows Consulting. She's been with Burrows since 2016 and is passionate about serving health centers and rural health clinics, having previously served as a project director, interim CEO, and director of strategic planning and development at Greene County Health in Indiana. Cara is a certified Lean Six Sigma professional with significant expertise in conducting community health needs assessments. She serves as a HRSA grant reviewer, and she specializes in completing HRSA-approved needs assessments and developing strategic plans for the health centers she serves. Today, Cara joins us to share her expertise on conducting community health needs assessments, which we hope that you'll be able to take and implement in your own organizations. So with that, I'll turn it over to Cara to introduce herself.
Hi, everyone. Thank you so much for joining today. And we will get right into it. If you have questions throughout, please feel free to ask them. I know we have a group on here today that may have some questions. We will have time at the end, but again, I'm happy to answer it as well during the presentation. Okay, so the first question is, what is health challenges in the area and gaps in available services? In that, it also highlights what services are there as well. It is a requirement for FQHCs, FQHC lookalikes, and nonprofit hospitals to conduct these needs assessment every 3 years. Usually health centers get theirs together right before a site visit as well. And it's just very helpful. It can guide the strategic planning process. It can create quality improvement plans and help guide them. It can redirect where current resources are going for health centers and where they might want to start putting a focus, or at least discussing with their board of directors. It's a very useful tool, and our health centers use it all the time on a regular basis. And we assist in conducting them. There are different ways to do it, and now we are going to go into that a little deeper. So key components of needs assessments include demographics, health status and disparities, social determinants of health, healthcare access and utilization, community stakeholder input, and priority health issues. I would like to go into a little more the community stakeholder input. There are different ways to do that that we'll discuss later, but nothing is wrong. So if you have a question on a way you can do that input, we've seen it different ways. It's been focus groups in the community, focus groups in the board, patient surveys, all different areas. So if you have any questions on that towards the end, please let us know. Healthcare access and utilization, factors to consider. When conducting a community health needs assessment, here are some of the factors to consider. Please note, there are other factors as well, but this is our list that we put together that we felt would be most helpful for today. Obviously, different areas also have different factors depending on their region, depending on the state, depending on the community health needs, whether they're rural or urban. So geography, again, identifying what's your population, where are they, what do they look like, are they rural, they're urban, what is in that data? So really drilling down to see what that is. Transportation, is transportation readily available? Is it readily available for all? What's that look like? Are people commuting long distances to get to certain areas? Transients, are there people coming through the area regularly? Maybe you are in Florida and you see an uptick in the winter months of people coming from the Midwest, or up north down there. Maybe it's an area that has a large farm worker population where you see more traffic in the summer. Unemployment, what's the unemployment rate look like? What's it look like for the state? What's it look like compared to the US? Income level, language preference, educational attainment. It really paints a picture of who you're serving and their access and utilization. Those are the factors you want to consider. So if there's a factor that's not there, it's not wrong. Our list could be even longer, and we just don't have time to cover that. So if you think it needs covered, it probably does. Add it to your needs assessment. region-specific health needs, social factors, physical environment, cultural, ethnic preferences, language needs, and housing status. I want to go to the physical environment. So think about where you're at. What you need to look up the data for the air quality. Maybe you need to look at the heat index. Maybe there was a catastrophic event recently in the area. All of those things can be included and should be included in your needs assessment to help paint a picture of the region you're serving and what the healthcare needs would be. Health behaviors and outcomes. So significant causes of morbidity and mortality. Again, here is our list of some of our top ones on here. If it's not on here, it still could be. This is the list of what we chose today. It's not wrong if you add additional ones. Diabetes, cardiovascular disease, cancer, low birth rate, smoking, substance use, obesity. These are some top ones we always want to include in the FQHCs and the FQHC lookalikes. However, there are many others. So if you have any questions on that, please feel free to ask now or towards the end. But okay, I think we can go to the next slide. Gathering primary data. So qualifying the need. So this is what I mentioned in the beginning. There are all different ways to do this. I've seen some really fun ways to do this, really great results on this. Surveys, focus groups, patient interviews, community stakeholders, town halls. I've seen some very successful needs assessments that really identify needs that maybe weren't shown in the quantitative data, however, was revealed by multiple focus groups. It came up each time. That helps let a health center or a hospital know, hey, this is really a need in the community. So focus groups can be a great way. If you're at FQHC, your board could be a focus group. And then you could also pick other ones in the community because you do have a health center board full of patients. So always think about that. Patient interviews. Again, interview your board members as well as your non-board member patients. Just find out about their needs. Community stakeholders. Some very successful focus groups we had involved the local school system, as well as maybe emergency management staff, and just were all very, very diverse. But it was interesting because all of those focus groups, they brought different things to the table, but then at the same time, they each identified similar needs in a certain area. So I thought that was very creative. It was probably one of the best ones I was involved in. Did include education. We see emergency technicians, we see EMTs involved, hospitals, but I hadn't seen them use the education system as much, and that was really valuable because they're really involved in the area youth. So I just wanted to bring that up here. Town halls are becoming more and more popular, and I think it's a great way to get community input. Serve some sandwiches, snacks, refreshments, and get some different faces in there. And get some different information because different people are going to give you different information in different ways, but then sometimes it can all be traced back to similar needs. And that's very, very helpful to you as you're looking on putting together your strategic plan and your needs assessment. Next slide. So secondary data, the U.S. Census Bureau, state and local health departments, hospital CHNAs, and UDS data. So for secondary data, it's very helpful. It can be very overwhelming. I know certain sites that we really like would be the county health rankings and roadmaps. We also like to use systems that maybe combine a lot of the Census Bureau data and a lot of data from other sources together. And that way we can compare and contrast. Sometimes that's a great way to look at a large amount of data, look at it from different resources, but have it all in one place. I know you usually do have to pay for those systems, and here at Burrows, if we are involved in your needs assessment, just know that we do have access to a lot of those systems and a lot of data resources that we use. We're also happy to recommend resources to you if you have any questions. Analyzing your data. So absolutely, compare the community input and feedback with the data resources. Do they tell the same story? Do they tell a different story? Establish 3 to 5 health priorities. You should be looking at state trends, local trends, national trends. I also want to point out something valuable that if you are in a very, very rural area, sometimes it's difficult to find data on certain points. And that's where those community focus groups, um, getting together with people in your local community, maybe it's at a local food bank, maybe you are talking to the hospital, maybe it's so small there's not a hospital, and you're talking to some of the other social service offices in the community. That's so important because you may be lacking data in a certain area just due to the size of your community. But if you can then get that qualitative data and compare it to the quantitative or use it if the quantitative data isn't there, it's really just telling your story. And to do that, you may need to get creative. You may need to get both resources and really think about it. Is this really a problem? Is the data just not available due to the size of our area? So that's something to think about. I just know as we work with some very, very rural clients who sometimes have difficulties finding the quantitative data. Presenting your data. Ask yourself, what do I want the reviewer to see? It's always good to think about what story am I trying to tell with this? After gathering all of this data, after having these focus groups, looking at my patient surveys, what's the story? What's the background behind it? Wording is everything. And I love this example. Thank you, Kate, for picking it out. I think it's perfect. Only 30% of children are obese. Is that powerful, or is it really 1 in 3 service area children is obese? Think about what story you are actually wanting to tell with your data. Maybe you're wanting to tell about overdose deaths in your area. Maybe the deaths are very minimal, but maybe the ER visits due to an overdose are very high. Maybe that's the story you're wanting to tell. If that's the case, you need to think about what data do you need to highlight to tell the story that came from all of these different resources, because you have it and you have to get it on paper to reflect how you need it to be framed for someone to understand it and for someone to see why you're choosing certain priorities maybe later for your strategic plan, why you are looking at certain quality initiatives. You really need to think about what story am I trying to tell and how do I need to tell it. Communicating data effectively. So we have an example here um, of a table, and then there's a chart. A lot of people are very visual. And sometimes if you give someone a 30-page needs assessment, for example, completely you just have words, no tables, no graphics, it can be a little overwhelming. Tables and graphics help break it up. They can help tell the story better. Use charts, use whatever you need. Just make sure you're telling your story and you're presenting it in a way that is digestible for the reader, that it's not overwhelming to them, and that it is broken up from time to time. Common mistakes to avoid. Using old and outdated data. This can be especially be where it comes into play in a rural area where you might need certain qualitative data. If the data you're finding is very outdated, maybe it's not available recently. Not citing sources. Always be sure to cite your sources. That way, anyone could go back, they could check them, they could see them. The reviewer might be interested in looking up more information on that resource. Not addressing social determinants of health. So not addressing things such as transportation that may be an issue in the community that does impact health because maybe people can't get to their appointments. Maybe there's a long distance and they don't have a vehicle. And that's something that really needs to be addressed in there. Using sources that really are reputable, always avoid that. You don't want to be citing Wikipedia in your needs assessment. It's just not something you want to do. Lack of community input. Again, I think getting the community input, whether you say, hey, I don't want to do a focus group, I just want to use patient survey data, great. But use that because you definitely want the input in there. Conflicting data points, always read through. And again, what story am I telling? Does my data conflict itself anywhere throughout? Not presenting an action plan. So basically, the ultimate goal of the needs assessment, you are wanting to create, whether it be a quality plan, strategic plan, you're wanting to use it for all your planning methods. So just making sure you present it in a way where you could act upon it. Okay. So I wanted to open it up for questions now. We have about 10 minutes. If there are any, please let us know. Otherwise, our contact information is here and you could feel free to reach out. And Elizabeth Burrows is on, so I will let her say anything else she would like to say as well.
No, I just think, again, this was a very commonly missed item on OSVs last year for FQHCs. So again, a lot of times it used to be the easiest thing to cross off your list. It's not anymore. So make sure you're ready because we did have quite a few people calling us after the fact and saying, oh no, I messed up. Can you help? So again, be proactive. Again, if you don't want to use us or work with another consultant, this is also a great project for MPH students, doctorate of public health students, if you have a university in your area to get them engaged on. So again, thank you. And thanks, Kate, for pulling this together.
Okay.
Awesome. Well, we do have a couple questions that I know came through with registration. So while everyone's thinking, we can get started with some of those. But one of the top questions was, what can CHNA findings be used for?
So CHNA findings can be used for quality improvement plans. They definitely should be part of your strategic planning process. They can be used for community initiatives. They can be used in decisions on how to allocate resources differently for different programs and where you maybe need to put more focus and more emphasis and more of your resources for patients. Elizabeth, anything to add on that one?
They also can be a basis for why you're writing other grants, even local grants, community grants, foundation grants. And again, also just a way to look at what do our providers need education in. If you have a high rate of childhood obesity, maybe you need to make sure your pediatric providers are being educated in that. If you have high rates of obesity, make sure maybe you're offering community education for obesity or diabetes or whatever those needs are. So again, it should do your strategic plan, your programming, services you provide. Again, you want to make sure that you're always basing your decisions, especially if you're board members or leadership of a health center or a hospital, on data from the community health needs assessment. And many times now, some grants and some opportunities are even asking that.
Oh, that's a great answer. Another question that we had was, are there some common challenges that you faced when conducting a needs assessment? And how would you suggest approaching those?
So I would say one of the most common areas, we deal with a lot of rural areas and would be finding data, and that's the quantitative data that is very recent, that does reflect the community. And to overcome that, again, that's where you also bring in the qualitative data to back that up. It's where you bring in community input, focus groups, town halls. Another common challenge would be getting together those focus groups. It's not always a fun task and it's not always easy. And that's where I would suggest perhaps doing a town hall, doing something where you have refreshments available, doing patient surveys, maybe texting out patient surveys and community surveys, maybe putting them up with a QR code, maybe having them do it on an iPad or a computer in the office, or even paper. So I think that is how you overcome it, because they might want to include that patient data, but they have a real challenge getting those focus groups together. Elizabeth, anything else that you can want to add on that? Perfect.
Another question may be, how do you balance or prioritize qualitative data versus quantitative data? Like, is there a situation where one might outweigh the other?
I think really, again, that goes back to what story are you telling? What's the data look like? Looking at your quantitative and qualitative and deciding how you want to frame it, how you need to frame it, in order to meet the community needs and reflect that so that a reviewer can clearly see it. I think in different times, you use the different data points and you just see what story you're telling. Again, it just all comes back to what am I trying to say and what do I need to use to say it? How can I best show the readers this? And that's where bringing those charts and graphs again, too. Um, People learn and people receive information in different ways. Some do, learn by through the reading of it. Others, the charts, the graphs, even a word cloud maybe from your focus groups. It's just going to be very helpful. Just be really creative with that in your presentation and using both to tell your story.
And again, that's why when you are writing grants, proposals, funding opportunities, you want to have different people review those because different people do learn and interpret in different ways. So I don't care about graphs. I want things in words, but I know a lot of people, they love a graph and a chart to demonstrate. So again, you want to appeal to different reviewers, different audiences, even to your different board members to explain it to your different patients, all of the above.
Awesome. We do have one more question, but I do invite anyone who's on to unmute or drop questions in the chat if there's anything else we haven't covered. But the last question is, are there strategies that might work best engaging community members who could be hard to reach? Maybe individuals who live in highly rural areas, populations who are unhoused, folks who have recently immigrated.
Yeah, we've done different things, either going to them, technology. You do find out most people in this world have a phone. That seems shocking to me, but most people have a smartphone. Even Medicaid populations, refugees, sometimes doing telecommunications methods. We've done individual meetings with, say, someone who does have a sensitive topic, such as unhoused people. Again, as Kara's mentioned a few times, offering food is always a big deal. Offering childcare can also be helpful. Things like that to reduce barriers. But again, I do think also offering them at different times of day, especially again where people can join by phone. Early morning, evenings, maybe a 7 a.m. and then an 8 p.m., things like that to better engage people of different ages and different groups. But again, that has been shocking to me is how many people can engage by phone. So definitely thinking of that as another method rather than people coming into certain facilities.
Awesome. Well, with that, we'll go ahead and wrap up our Q&A section. If there are questions that we weren't able to answer today, please do feel free to reach out to us. You have both Kara's and Elizabeth's contact information, and we are happy to hear any questions you might have. We will also be sharing this recording on our YouTube page and via email later this week. So if you gain some insights that you'd like to share, we do invite you to share this with colleagues or other connections who may benefit from learning more about needs assessments. Anyway, thank you so much for joining us today. Do keep an eye out on our website for more webinars to come in 2025. Thanks, everyone.